Sam Cook-Bateman has lived with chronic pain from endometriosis all her adult life.
A number of years ago, I had a sacral neuromodulation unit implanted, which is essentially a battery and 4 wires into my spine, which stimulate the nerves to control lower abdominal pain.
Every day when she connects herself to this device, the pain eases. By 2015, she had already had 9 operations to treat her endometriosis, 3 of those with Dr Omar Adham at Calvary John James Hospital.
He had performed 3 laparoscopes and all went well. He removed lesions and I felt better afterwards.
But in 2015, 2 days after another operation with Dr Adham to have endometriosis removed, Sam suddenly experienced massive abdominal pain.
My husband knew that something was wrong, so he immediately rang Dr Adham's rooms, and his response was to my husband, put her in the car and drive her straight to Canberra Hospital. He asked if should he call an ambulance. His response is, "We don't have time." It was terrifying. I remember being in the back of the car, laying down, screaming.
Sam was rushed in for an emergency operation. Surgeons found an extensive thermal injury to her rectum. They said it was consistent with her recent surgery. A perforation meant leaking faeces was draining into her abdomen. Sam had part of her bowel removed, requiring a colostomy bag for 8 months.
And I knew I was in trouble. I felt down my abdomen, and I remember I could feel the colostomy bag. I didn't understand what had happened, and I was scared of what this meant.
Dr Adham visited Sam in hospital and saw her again in his office weeks later.
And I asked him what he thought went wrong, because to that point I'd had no explanation. His response was, "I don't really know. I cauterized a bleed like I've done 1,000 times." That was the explanation I got.
Since the initial emergency surgery, Sam has had 2 more bowel operations with another surgeon. She lives with daily bowel pain.
And it's not endometriosis pain, it's my bowel. It's difficult for me to process fibre, which is in pretty much everything. I'm on 8, 9 different medications for various things, including anxiety and depression.
Sam Cook-Bateman contacted 730 after seeing our story in July about former patients of Dr Adham's who said they'd suffered after complications and repair surgeries. One of those women was Christy Stanford. She also suffered a bowel injury due to a thermal burn, which Dr Adham had warned her there was a low risk of. When she went to emergency days later with excruciating abdominal pain, the Canberra hospital took 2 days to operate.
They did remove part of my bowel and then they put on a colostomy bag, which was a real shock.
So what can go wrong with using those thermal instruments?
Well, damaging an organ.
And how common is that?
It should be relatively uncommon. I mean, it's an acceptably known risk, but it should be still rare.
Christy ended up in intensive care for a week. Sam Cook-Bateman's surgery and bowel complication happened just 3 months later. The Royal Women's Hospital says the risk of bowel damage in this procedure is 1 in 3,000, although it can be much higher, as great as 1 in 20 for serious complications with very invasive endometriosis. The ACT's Health Minister told 730 Dr Adham's complication rates have been reviewed and are consistent with other practitioners. Juanita Connors also contacted 7:30 after our story. In 2018, the mother of 4 sought help for chronic pelvic pain. She'd had severe pelvic pain most of her adult life and had been diagnosed with probable endometriosis 14 years earlier. Dr Adham said he'd do a laparoscopy to investigate. On the day of the surgery, as she was lying on the gurney in preparation for her operation, Dr Adham said he wanted to add an extra procedure.
I just remember him saying it's gold because it was going to be, my life was going to be improved after this surgery. And he just passed me a piece of paper, said I need to sign here and I think here.
Dr Adham later said he advised Juanita the operation may or may not help with her pelvic pain. The procedure was an ablation or burning of nerves or ligaments near the spine to disrupt pain signals. Juanita says she continues to suffer terrible pain, although no one has linked it to the operation.
It's just a constant ache, a pain in the bottom of my back. Sometimes I get Matt to rub my back where he can't even touch it, and it would come from all around my hips. It would be all swollen, but the pain would be from the middle of my back. So this is 3 years worth of paperwork that I've collected.
Juanita complained to Canberra Health Services, saying the procedure hadn't been explained properly. 7 months later, she received a response from the CEO.
It says, I apologise if you feel the procedure was not clearly explained to you prior to your surgery.
Juanita was dissatisfied with that response, and with the support of her husband Matt, she went to the complaints body, the ACT Health Services Commission.
Juanita will be able to send that in the next couple of days.
When the Commission made inquiries, Dr Adham insisted Juanita had been properly advised. He said he'd offered her a minor add-on optional treatment that was generally part of the endometriosis treatment. He said she'd consented and did not raise concerns. The Health Services Commission got an independent expert who told them studies showed there were doubts about whether the procedure done on Juanita was effective. One major study had shown it had no value for patients having endometriosis surgery. But given Juanita's significant pelvic pain, the expert thought it was reasonable to do the procedure. Critically, he said he thought Juanita had been appropriately consented.
Not even spoken about until she was getting wheeled into surgery. We don't think we would have chose that surgery if we had any time to research it.
In November last year, the medical board contradicted the expert opinion. While the board said there was insufficient information to determine that Miss Connor's ongoing pain was caused by this procedure, it issued a caution to Dr Adham over the consent process. It found his performance regarding consent was below the standard reasonably expected of a registered medical practitioner. This would mitigate any future risk to patients. But that caution was not made public on AHPRA's website, as is the case with all cautions. Lawyer Tom Ballantyne believes that's wrong.
Certainly I think there's scope to include more information on the register. There are some actions taken that aren't on the register at all. So a lot of patients are actually operating in a vacuum when it comes to understanding and being able to research their doctor's history and performance and track record.
What did they find there?
From my understanding, it was normal, and the biopsies that were taken were also normal.
After years of suffering and more procedures, Juanita is still seeking answers from specialists, trying to find out the source of her pain.
It's like I'm fighting a losing battle. Just trying to get diagnosed with what's wrong with me. I am now on antidepressants, and that's also to help with the nerves. But honestly, I think if I wasn't strong enough and I didn't have my kids, I wouldn't be here.
Complaints to AHPRA from 7 former patients of Dr Adham's have now been assessed by the medical board as needing further investigation. In the meantime, nothing appears on his registration.
Often in cases where you would have a series of serious complications, restrictions would be put in place as an interim measure while the regulator investigates.
Although AHPRA hasn't done that, there have been some changes to Dr Adham's practice. Queanbeyan Hospital says he's ceased working there, but Dr Adham says that's a suspension subject to reinstatement following a positive review by the hospital. At Canberra Hospital, Dr Adham has volunteered to have a senior colleague present during all keyhole surgery. He says it's to show that he has nothing to hide in regard to his clinical competence. Canberra Health Services says a review of Dr Adham's cases show his complication rates for laparoscopic surgery are consistent with other practitioners.
If the hospital indicated that it was not concerned and that it had perhaps done a review or looked at his practice and it was comfortable, then that would greatly reduce the risk from the board's perspective.
David Gardner spent 4 years at AHPRA as an investigator and inspector.
A cluster like that where it's more than one or two certainly would raise the alarm bells a little, and it's something where I would expect that the staff inside the regulator are very seriously considering the position and putting extra resources into the matter.
Dr Adham told 7:30 the claims against him are yet to be tested, and it's important not to preempt those processes.
There are properly established processes in place for the resolution of such claims, whether before a court of law or the health regulator. For that reason, I consider it would be inappropriate for me to respond to the ABC's questions. Rather, the claim should be determined in the proper forum once all facts are known, instead of prematurely becoming the subject of speculation by the public based upon only one side of the story.
Dr Adham said he'll wait for the outcome of any findings by a court or AHPRA. He's confident they will find no wrongdoing on his part. In September 2019, while Dr Adham was dealing with Juanita Connor's complaint about consent, another patient was left confused about what happened to her. Only this time it was to do with obstetrics. Casey Tompkins had hoped to have a normal birth, but she had problems with her cervix and the position of the baby. When the labour stalled, the staff obstetrician at Canberra Hospital advised her to consent to a caesarean section.
We had signed a consent form. We'd gotten our head around the fact that it wasn't going to be the traditional birth that we were expecting. We were both prepped.
But when Casey was wheeled into the operating theatre at midnight, a different obstetrician, Dr Omar Adham, was there. To her surprise, she was asked to try and deliver the baby naturally because she was fully dilated.
I remember being a little bit surprised because it had been explained to us that we were going in there for a caesarean.
Dr Adham then attempted to get the baby out using a vacuum or kiwi cup and forceps. The couple say they don't have any recollection of being asked to consent to instruments. Casey had had an epidural, meaning she couldn't feel anything. A C-section drape was blocking the couple's view and made it difficult for them to register everything that was being said.
I don't have memory of him using the words, Casey, we're going to try forceps, or Casey, we're going to try the kiwi cup.
A statement from the Royal Australian and New Zealand College of Obstetricians and Gynaecologists says there must be clear communication to use instruments, and written consent should generally be obtained in an operating theatre. There was no signed consent for instruments on Casey's medical records, and the midwife's notes don't mention consent. They say there was a decision for assisted birth. Dr Adham's handwritten operation notes say there was consent to instruments and consent to have forceps applied.
Consent is written 3 times. When I read those notes, I genuinely was shocked.
When the instruments failed, Dr Adham reverted to a Caesar. A social worker later wrote that Casey had gaps in her memory, but the couple say it was only after their baby was born that they realised instruments had been used.
Billy's injuries were a cut over the top of his lip and up to his nose, and scattered cuts and dents over his skull, and a large dent on his forehead.
Those injuries can occur with instrumental deliveries, but Billy also had a rare subgaleal hematoma on the back of his head. Hospital records say this was caused by multiple trials of instrumental delivery. Guidelines from the College of Obstetricians and Gynaecologists say this occurs in approximately 1 in 300 vacuum deliveries. In some cases, for babies with low scores on the clinical indicator scale, it can be potentially life-threatening. But Billy's indicators were good. Billy was put into intensive care as a precaution.
Nick sort of came over and said that they needed to take him somewhere else to have a look at him. And I think that's when fear crept in a little.
Billy recovered and after 3 days left ICU. Casey developed postnatal depression and was later diagnosed with PTSD. The couple later organised an appointment to see Dr Adham, wanting to know what had happened.
I do remember him saying that the hematoma could have been caused from the pushing, not from the kiwi cup. He did explain with the forceps that forceps, once they're in the correct position, they lock. And then he went on to explain that just the timing between applying the first blade and him moving would have been seconds maybe, and he just moved that much in that time. And that was sort of the explanation that we received.
Dr Adham wrote to Casey's GP after the meeting, saying the couple was traumatised because baby Billy had extensive facial bruising as a result of the attempted forceps delivery. However, he made no reference to the subgaleal hematoma nor the intensive care stay. Two years on, Billy is a happy toddler. Casey still suffers from depression. Casey and Nick were later told the case had gone to the hospital's Quality Assurance Committee, but they don't know the outcome.
Come on. Mama. Hang on. If we had had the caesarean as decided, as planned, we would have potentially gone home the next day.
We sent questions to the Canberra Hospital, Calvary John James and AHPRA. Canberra Health said it continually benchmarks clinical outcomes and that quality and safety is paramount. Calvary John James said it had received no complaints from the patients regarding Dr Adham, and his registration shows no conditions on his practice. AHPRA said it cannot comment on matters regarding Dr Adham and his employer. A parliamentary inquiry is due to hand down a report on AHPRA's handling of investigations in March. The first investigation into Dr Adham that 730 reported on was referred to AHPRA almost 2 years ago. AHPRA has not said when it will be completed. None of the women we've spoken to who have complained have been interviewed by the regulator. Many of them are taking their own legal action.
If the public doesn't trust the regulator, if they don't have faith that they'll deal with their complaints in an efficient and transparent way, then they just won't make the complaints. And that's a real problem.
The current system is so fragmented and the regulator, the board, is not permitted to look at a health service. It can only look at an individual. I think the system as it is now is wholly unsuitable.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.